Dr. Moore, thanks so much for doing this. I want to start with the 80% first dose, 75% fully dosed benchmark for adults to move past step 3 of reopening. To some, that seems like an awfully high bar. Why do we need to be so cautious?
In the face of Delta, which is a more ferocious foe and wants to spread more quickly, the higher the immunization protection we can achieve going into the fall, the less we'll have to worry about outbreaks, the less we'll have to worry about missing school or work, and we'll be able to enjoy the things we normally can do throughout the fall and winter without being too concerned and without having a burden on our healthcare system.
There'll always be some people who don't want to get vaccinated, and demand overall has plateaued. If the rates don't climb much higher, do we just stay in phase 3 perpetually?
We absolutely do anticipate that we'll hit those targets of 80-75. It just may not be on August 5th, where we'll move out of step 3 in a complete reopening.
So it may take longer than the minimum 21 days to move from phase 3 to full reopening?
It may be a couple of days delayed, but we will get there.
How much longer will we all have to wear masks, even if we're fully vaccinated? And should children be wearing them when they return to school?
I'm following what's going on in Alberta right now. They stopped their mask mandate and their rates have tripled within a week to 10 days. To me, it's pointing that we should continue to have masking as our economy opens. After step 3, there'll be no public health measures in place except I expect the recommendation to mask in public spaces. I'm looking very strongly towards endorsing masking in public spaces.
Dr. Moore, the Registered Nurses Association has called on the province to mandate vaccination for healthcare workers. Would you recommend a vaccination mandate for healthcare workers or even government employees?
We're not there yet. We've got very good voluntary uptake in the vaccine across Ontario by our health professionals. If we're not achieving high enough rates and there's risks to patients, that's when I would have to reflect whether we should have an immunization policy.
Dr. Moore, thanks so much for your time.
Pleasure, Matt, and happy to do it again sometime.